I'm so excited to introduce our presenter, Rachel Schumann and Flor Ramirez.
So Flor actually won't be joining me this evening. Flor did
Oh, well, we have
join.
Lynn Decker.
We have Lynn Decker, though, who was also
Wonderful.
here earlier. Um, Flor has childcare responsibilities, and the only children I have are fur babies, so they've
It
been
counts.
fed and taken care of, so I can be be here. So I'm going to share my screen and pull up our PowerPoint and get started. Okay. Can you see the PowerPoint okay, Kate?
Perfect.
Okay, awesome. So as Kate mentioned, I'm here to present to you all today on the IDDO, or the Intellectual and Developmental Disabilities Ombuds Program. We also presented to LifePlan and ACA members and staff earlier today at 12 p.m. So this is going to be the same presentation that we had earlier today, but if you just really want to, if you were here earlier and you just really want to know more information, you're welcome to stay. Yeah, we'll get started with some introductions. So my name is Rachel Schumann. I'm the Training and Outreach Manager for IDDO. Tell you what the program is, but before that, just a little about me. I'm a licensed master social worker. I have experience helping individuals navigate Medicare and Medicaid, and I am personally connected to this work. I have 2 siblings on the autism spectrum. And my colleague, Lynn Decker, I don't know if you, Lynn, want to quickly introduce yourself to the room.
Hi, my name is Lynn Decker. I am the Quality Assurance Manager for the IDD Ombuds Program. My work credential is I have a master's in public administration. My lived experience is that I've worked in this field back when we had Medicaid service coordination and as the manager of a Without Walls day program. I also have 2 sons who are young adults who live in certified residential settings in the state of New York.
Thanks, Lynn. Lynn is kind of an encyclopedia, has encyclopedic knowledge about the IDD system. So we're very lucky to have her on our team. So basically what I'm going to talk about is what is the IDDO, what is our program, and kind of how I got started and, why we exist. The IDDO is a program that is operated by a larger nonprofit called the Community Service Society of New York, or CSS. So I'm going to talk a little bit about what CSS is, and then I'm just going to go into, what we really do as a program, how we help individuals and families directly, what kind of education and outreach we do, and our advocacy. So what is IDDO? Up on the slide is our logo. If you are joining us from a computer or smart device, if not, you'll have to check out our website or socials for that logo. So we are an ombudsman program. So some people may already be familiar with this term, but in case this is your first time hearing it, we like to define terms here. So ombudsman is a Swedish word that means representative, and an ombudsman's job in short is to advocate, educate, and mediate, so help resolve problems. And there are different types of ombudsmans in all different types of places. So nursing home ombudsmans, hospitals, universities, government agencies, insurance companies, all of these places can have different types of ombudsmen. So now that you know this word, you might start to see it when you are out and about. So how did IDDO get started? So advocates in New York State had wanted an ombudsman program because the Office for People with Developmental Disabilities and the service system is really complicated. And there was a feeling that there needed to be some agency or some program that was devoted to helping people navigate and understand what services there are, what's available, what are people's rights. There was also a feeling that, you know, there needed to be an objective resource for information. So, you know, and to educate people, and then to serve as an advocate for people with IDD and protect their rights. So in 2023, New York State Mental Hygiene Law 33.28 was passed. And this law required the Office for People with Developmental Disabilities, or OPWDD, to find or to procure an organization that was independent to be an ombudsman. And in 2024, Community Service Society of New York was chosen and provided the funding to create the Ombudsman program. So we are independent of OPWDD, but we do get our funding through them. We decided to call the program IDDO, or the Intellectual and Developmental Disabilities Ombuds Program. So what is Community Service Society of New York? So CSS has been around for a long time, over 100 years. We are a nonprofit that promotes economic opportunity for New Yorkers, and we do this through our direct services, advocacy, and research. So as I mentioned, CSS is a larger organization that has a bunch of different programs and services. So the main kind of thing that we're known for is our statewide live answer helplines. So each one of our programs has a live answer helpline. And what we mean by live answer is that, you know, we really aim that when you call us, that someone live is there to pick up the phone during our operating hours. So usually that's 9 to 5, but some of the helplines have slightly different hours. We also have partnerships with community-based organizations, or CBOs, across New York State. And our programs help with a variety of different things. We help people enroll and use their health insurance. We, help people access the different health care and services that they need. We have a program that focuses on student loans, financial literacy, and public benefits. And we also have experience running other ombudsman programs. So Community Health Advocates is a health insurance, all health insurance ombudsman for New York State. ICANN, or the Independent Consumer Advocacy Network, focuses on Medicaid managed long-term care for individuals who are receiving care in the community. This also includes an ombudsman for folks who have health insurance through Partners Health Plan, which is the FIDA IDD program. And then we have the Managed Care Consumer Assistance Program, which is similar to CHOP, but just focused on New York City, and the Community Health Access to Addiction and Mental Health Care Project, or CHAMP, which is our ombudsman that focuses on access to mental health and substance use disorder treatment. So here's kind of the short timeline of events. The mental hygiene law was passed. OPWDD in February 2024 released a request for proposals. A bunch of organizations applied. OPWDD chose CSS to be its ombudsman. CSS hired and trained staff, including myself and Lynn. And then the IDDO program was launched in December of 2024. So that's just kind of a brief timeline. So we're a relatively new program. Now we're in June of 2025, and we started answering our helpline in December. So we're still relatively new, but we have a lot of experienced staff like Lynn and myself who either have, lived experience or have worked in disability services for, a long time. So we're small and new, but we are mighty. Our mission. So our mission is to act as a resource and an advocate for individuals and families as they navigate OPWDD's programs and services. So what exactly do we do? So we help. We have a helpline, which I'm going to talk about. We also do casework. So basically what that means is if someone contacts our helpline and they have a problem that can't be resolved over one phone call, it's kind of a thorny or sticky situation, we will, and it's something we can help with, we'll have one of our staff assigned to work with that person, and if they've designated a representative or a person that they trust, we can work with them to try to resolve their issue. We also do presentations. A lot of our, education and outreach has been focused on letting people know about the existence of our program, but hopefully over time we can, we hope to do more educational content about people's rights and OPWDD supports and services. And then we advocate. So we not only advocate for people through our casework, but we also advocate for broader change. And we do that by looking at the data and trying to understand what are the major issues that people are contacting us about. What parts of the state are they calling from? What is impacting people the most, and reporting those issues to OPWDD. So what exactly do we do to help people? So we do talk to people about OPWDD eligibility kind of generally. I'm assuming that maybe I don't know if I should assume, but I'm assuming many of you on this call are either ACA or LifePlan members or staff, and so you might not need assistance with understanding OPWDD eligibility and the waiver, but we do get quite a number of folks who haven't been connected to a CCO or haven't gotten accepted to the waiver, and they just don't know where to start. So that can be something we can help with. We also help people find providers or understand what evaluations and assessments are needed, both for eligibility and for other services. We also help people navigate housing. So the housing subsidy is a common one, or answering questions or helping people appeal denials of the certified residential opportunities referral. We also work with care managers and CCOs. One thing, that we will say time and time again is that the role of a care manager is super important. We're not here to replace or act as a care manager, but we will work with care managers and CCOs in certain situations. So that is something else we do. We also help people navigate a service delivery model called self-direction. If you want more information about that, I'm sure your care manager should be able to give you more information, but we're also happy to provide that, and other home and community-based services. And then we advise people on what their rights are. So whether that's the right to request a fair hearing, a conference, and other rights. And we work with people directly who are trying to, if they get denied eligibility or housing or other OPWDD supports and services, we work with them to understand why they got denied, what their rights are, and help them figure out what next steps are. So again, we don't replace care managers or CCOs. We also don't assist with school-based services and support. So if you are a parent or guardian of a child who has an individualized education plan, or you're looking for assistance with Section 504 accommodations, unfortunately, that's not something our program can help with, but we are always happy to connect people to the appropriate resources and referrals. We also don't assist with access to early intervention services, but again, if someone does contact us and they need connections to those services, we will do our best to point them in the right direction. So if you have an issue and you want to reach out to us, you can contact our helpline Monday through Friday from 9 a.m. to 5 p.m. We are staffed by 5 counselors, 2 attorneys, and 4 managers, and our helpline serves all of New York State. You can reach us at 1-800-762-9290. You can also email us at iddo@cssny.org. We also are in the process of launching our website where we will have a contact form. For now, our contact form lives on CSS's website on the IDDO landing page, but hopefully we will have our own website with our contact form to share with you all shortly. So education and outreach. So CSS doesn't work entirely alone. We do work with parent and caregiver groups, self-advocates. We do have a specialist, New York Lawyers for the Public Interest, that provides our staff with training and other technical assistance. And then we have our regional outreach networks, which are made up of 9 community-based organizations across the state. So up on the slide is a list of our partners. I'll read them out really quickly for you all. So we aim to have at least 1 partner in each of the 5 regions, OPWDD regional field offices. So we have Western New York and the Finger Lakes. We have Center for Self-Advocacy and Autism Up. Region 2, we have Mountain Lake Services and Southern Adirondack Independent Living, or SAIL. In Region 3, we have Westchester Institute for Human Development, or WID. In New York City, we have Include NYC and Community Inclusion and Development Alliance, or CEDA. And in Long Island, which is Region 5, we have Mid-Island YJCC and Extraordinary People in Care Long Island, or EPIC. And these are our community outreach and educational partners, which means they're promoting our program at events, workshops, social media, and other outreach. So you may, see the IDDO logo or information about IDDO coming from these organizations. And if you live in, if you don't know these organizations already and you, want to check them out, each of them do really great work. Apart from being one of our outreach partners. And here is a picture of our team. We look forward to working with you. And here is our helpline again, 1-800-762-9290, email iddo@cssny. We also have a Facebook page and an Instagram. So if you are on social media, feel free to give us a follow or a like. And we'll also be posting updates including our website launch on there as well. So stay tuned for that. And with that, I will stop sharing and open it up for questions and discussion.